Hey everybody, this is Dr. Greg Barnes with Triangle Health Center in Morrisville, North Carolina. And this video is going to be about headaches and looking at common causes, commonly overlooked causes for your headaches. So you'll want to tune into this short video if you are a type of person who is looking for an alternative way to help your body heal and get rid of headaches without covering up them with Tylenol or aspirin, ibuprofen, or other pharmaceuticals over the counters. So what we're going to be talking about here today is the relationship between your spine, particularly your neck, and the nerve health that's going on in there. And what we have here is a side view of the neck, or what's known as a lateral cervical x-ray. This is the person's back of the head right here. They would be facing this way, so their nose would be somewhere over here. Now, when you're looking at this person's x-ray, an important thing to note is that this green line right here is demonstrating what normal alignment would be for the neck. There has to be a nice 45-degree curvature that would travel along that green line right there. So you can see with this person's x-ray that these red lines are actually bending forward in the opposite direction. So what that's referred to as something is called kyphosis. And what that means, so you think about this, how does that affect your body? If you imagine your neck is kind of like a banana in a sense that there's an outer portion to it and then inside the fruit. Well, inside of your neck right here is going to be your spinal cord and the delicate nerve tissue along with the joints themselves. And when you take a banana and start moving that in the opposite direction, right? Eventually, of course, the banana would really smush or even break the outer, fruit part of it. But on the inside, it's definitely causing compression. So if we're talking about the nerves that are in here that are coming out there, that are going to your neck and your shoulder muscles, that's going to cause irritation, interference, even potentially damage and cause, chronic issues. So that would be something what we call a cervicogenic headache, meaning that cervical meaning neck, and genesis or genic, creation or origin of. So it's headaches that are coming from your neck. So that's a common cause for that type right there, is loss of that curvature. Now, the reason why that's a big deal is that everybody for a living, right, is working in front of one of these things like this all day long. We're on our phones, we're bending over. So this is a very common problem that we see with patients that come into our office, is that they've lost that curvature in their neck. And surprisingly, the majority of them that have it, and they have headaches, or they have neck and shoulder issues, they've been to doctors, they've even maybe been to neurologists, and they've never had another physician or doctor take an x-ray of their neck to see what does the alignment show and what could it be causing damage or interference on. The second area that is very problematic in terms of headaches is at the very top right through here, called the upper cervical area, or the top of the neck. So again, remember, this is the back of the person's head. So on me, it'd be like right in through here. And then this bone right here is the very top portion of the neck. Now, normally, there should be a space in between this bone right here and the base of your skull, okay? And there actually should be a space below right here as well. So you can see a little bit of a space above and below, but it's much smaller than it's supposed to be. So what happens is that when that area compresses down right here, you have a large amount of nerves that actually come out through what's called the suboccipital triangle. And there's nerves that come out through here and they go up the back of the head. They go up into the temple a little bit, and even can travel all the way around to like the temple, eye, and even forehead area a little bit. So that's another really common cause or type of headache that people have. Again, surprisingly, the majority of them that come into our office have never had an x-ray to show them, is that area compressed, is it damaged or interfered with, and does it need to be adjusted to open up? So that's what the kind of care that we provide in our office is what's called corrective care. So when we take an initial x-ray on someone's neck and find out what their alignment is compared to normal, well, then we can reverse engineer a care plan to determine, okay, how do we get this person's spine back to the best position in the most efficient amount of time, so that we reduce and eliminate, ideally, even the interference or the tension that's going on in those muscles, in those ligaments, in those joints, and in those nerves themselves right there. So if you've never had this looked at, or you have not had it looked at for a long time, but you suffer with headaches of any kind, and again, you're looking for a solution or a different path to help your body heal and function normally, then we really encourage you to check out our office. You can call us at 919-469-0900 and ask about our online Facebook special, or you can click through our website, which is trianglehealthcenter.com, to get more information there as well. So we are running a special right now for anybody that finds us through social media, whether it's Facebook, Instagram, or YouTube. So be sure to mention that when you call in as well, and we'll do our best to get you in as quickly as possible to meet with the doctor and see if this is something that you have going on and something that we can help with as well. So hope you learned a lot. Have a good day.